Welcome to my channel Health for You. What causes nausea and vomiting during pregnancy? Your nausea is caused by high levels of pregnancy hormones flooding your body. It's very common. Up to 9 out of 10 pregnant women experience nausea or vomiting. Now that you are pregnant, your body is producing the hormone human chronic gonadotropin (HCG) in large quantities. This hormone makes sure that your baby gets what he needs from your body in the early weeks. Once the placenta takes over nourishing your baby, HCG levels drop and your nausea should ease. Other hormones can contribute to nausea and sickness in pregnancy, such as estrogen and possibly stress hormones, such as cortisol. Being low in certain nutrients, including vitamin B6, is another cause suggested by experts. Being sick is miserable, but as long as you are drinking plenty and not losing weight, your health and the well-being of your baby shouldn't be affected. Hopefully, your morning sickness will subside between about 14 weeks and 16 weeks. For some women, however, it can continue for a little longer. For an unfortunate few, it lasts throughout pregnancy. If you have very severe sickness and struggle to keep down even water, see your midwife as soon as you can. You may have a serious form of pregnancy sickness called hyperemesis gravidum (HG). HG can leave you dehydrated and undernourished, and you may need treatment in hospital. How can I prevent nausea during pregnancy? It is difficult to prevent sickness completely. It is a natural and normal part of pregnancy. However, you may be able to stop it from becoming a major problem. Relaxation and complementary therapies may help you to reduce your stress levels. Get plenty of rest and consider taking time off work. Eat little and often. Plain foods such as potatoes, pasta, rice, and dry crackers are often easier to stomach. Work out which foods make your symptoms worse. Rich, fried, fatty, or highly spiced foods are common triggers for many women. Try to have foods rich in vitamin B6, such as avocado, bananas, and chicken. Taking a vitamin B supplement may also reduce your nausea if you can swallow the pills, but they probably won't prevent you from vomiting. Always talk to your midwife before taking supplements in pregnancy. If you are feeling very sick, try not to worry about eating a balanced diet at this stage. You and your baby can catch up on nutrients later in your pregnancy when your nausea should have subsided. Most importantly, keep well hydrated. Sip iced water, lemon juice, barley water, or whatever you can manage. Which complementary therapies could help during pregnancy? Unfortunately, we can't say for sure that any complementary therapies will help you with morning sickness. However, feeling sick during pregnancy can be so miserable that you may feel that anything is worth a try. There are some treatments you can try for yourself without seeing a therapist. If you do book a treatment, always see a registered, insured therapist who is experienced in treating pregnant women. Acupressure and acupuncture. There is some evidence that acupressure and to a lesser extent acupuncture may help you to tolerate your sickness better. These are safe to try, although the evidence is not strong that they actually work. Studies have also shown the acupuncture relieves nausea after surgery and chemotherapy. You should try acupressure anytime you feel sick by pressuring an acupuncture point, pericardium point 6, on your wrist. You can buy wristbands that help you to apply this pressure. Make sure that the button in the band is placed on the acupuncture point to locate this. Using one hand on the inside of your opposite wrist, measure up 3 fingers widths from the crease between your hand and arm. At the point where your third finger is, lift the pressure off until you are just touching the skin and feel lightly for a slight dip. Press into this dip quite deeply and it will feel bruised. Place the button on the wristbands at this precise tender point on both wrists. Put the bands on first thing in the morning before you get out of bed. When you experience a wave of nausea, press on the button on each wrist 20 times to 30 times at 1 second intervals. If you forget your wristbands, you can simply press on these 2 points or ask someone to do it for you on both wrists at the same time. Aromatherapy. Aromatherapy may relax you, but the smell of the oils could make your nausea worse. Try a few to see if they help. Essential oils that may relieve your nausea include peppermint, spearmint, lime, lemon, sweet orange, mandarin. Ginger essential oil is recommended to be used with caution, as some aromatherapists believe it can lead to bleeding and trigger contractions. Herbal remedies. Fresh ginger or ginger teas are often claimed to ease pregnancy sickness, and experts agree they are worth trying. However, it depends on how sensitive you are to certain smells and flavors. Ginger may make your symptoms worse or give you heartburn. Chinese medicine takes the approach that a remedy's effectiveness can depend on the type of person you are. It's based on the system of yin and yang and other opposing factors including heat and cold. According to Chinese medicine, ginger is a hot yang remedy, so it may make your sickness worse if you are already too hot. Ginger may suit you if you like to wrap yourself up in layers of clothing and blankets, feel miserable, introspective and uninterested in your surroundings, feel and look cold, need hot drinks. Ginger biscuits and ginger beer are not the answer, as these contain a lot of sugar which can cause blood sugar highs and lows, making you feel worse. Ginger biscuits do not have enough ginger to be effective. You could make a tea from grated ginger root, steep 2 teaspoons in boiled water, leave it to cool, and sip it throughout the day. Don't take more than 3 grams of raw ginger, about 3 teaspoons a day. Ginger capsules are an option if you don't like the tea. Ginger works in the same way as prescribed medicines and may affect how your blood clots. If you take it for more than 3 weeks, ask your doctor to check your blood clotting. If you are taking prescribed anticoagulant drugs, aspirin, or other similar medicines, you should not take ginger at all. In Chinese medicine, peppermint is cold gin. It may be suitable if you feel constantly hot and want to remove layers of clothing, want cool drinks, look hot and bothered and red-faced, feel irritable and hot-tempered. Try sipping peppermint or spearmint tea. Sugar-free peppermint sweets or chewing gum may also help. Peppermint or spearmint essential oil will not suit everyone, as the strong smell could make you feel more nauseous. Other herbal remedies worth trying include lemon balm tea or small amounts of chamomile tea. The effects can be quite short-lived, so you may need to experiment and perhaps rotate the remedies to get the best effects. Homeopathy. There is no good evidence that homeopathy works, but if you did like to try it, make sure that you see a qualified registered practitioner. Hypnotherapy. Hypnotherapy may work for you if your symptoms are made worse by stress, anxiety and fear or other strong emotions, but there is little evidence that it's effective in combating pregnancy sickness. Music app. If movement such as being in a car makes your sickness worse, you could try an app to reveal sickness. The app contains music with pulsations that help to rebalance the fine, sensitive hearing mechanism in your inner ear. You did need to wear headphones rather than earphones to allow the music and pulsations to rebound against your eardrum. Reflexology. Reflexology follows the principle that your feet represent a map of your body. The theory is that pressing certain points on your feet will help to ease your symptoms. There is no strong evidence that reflexology works to treat nausea or any other condition, although you may find it is a relaxing treatment.